Dr. Gary Sykes, Obstetrician, Sydney Adventist Hospital. Antenatal care is important, particularly for a woman's first pregnancy, first childbirth experience. And that's because she really doesn't know. At the first antenatal visit, patients are asked by me, I ask them, do you have any questions? And they say, well, I don't know what to ask. And that's quite typical. Yes, they don't know. They're excited that they're pregnant, they're looking forward to cuddling their baby, but they have no idea what that journey ahead is going to be all about. And that's where antenatal classes can fill the gap. They can give that woman an overview, give them a lot of information, a lot of insight as to what's going to happen on that pregnancy and on that labour and childbirth experience. So, and with that, it can calm them, it can help them relax more and understand more. So when things happen, they know. When things happen, they know. Oh, they cover this in the class. You know, if they want an epidural, they know what it's going to be all about. If I have to do a vacuum delivery or put a suction cup in the baby's head, I'll show it to them beforehand. Did you see this class? Oh yes, I saw that in the class. We covered that in the class. They know, and so they're not as fearful. So it helps them on that journey to understand what's going to happen, help to understand what they can do to help optimise their chances of everything going extremely well. So I think antenatal classes are very, very important, particularly for that lady who's pregnant for the first time. When talking about antenatal classes, there's usually two options. One option is they attend classes here at the hospital, which are run by the hospital staff. Now, to me, that's preferable, because the people doing the classes are working here at the hospital and they understand the hospital, they understand what happens on the birthing unit. So they give them very real information that's very relevant for this particular hospital. Because not all hospitals do things the same way. And so we have the option of online classes, which are fine, they're very, very informative, but it will be more general information they receive because the people doing those classes aren't employed by the Sydney Adventist Hospital. And so everything they say may not be relevant for what actually happens in this, at this hospital. While it's a good idea, the woman should be quite open-minded, because they'll have to be speaking very generally rather than specifically about what's going to happen to them when they attend the Sydney Adventist Hospital.